Welcome to this core module on patient assessment and treatment planning. In the world of aesthetic nursing, it is often said that the most important part of the procedure happens before the needle ever touches the skin. Patient assessment and planning form the absolute foundation of a safe clinical practice. Before any botulinum toxin injection is performed, you as the provider must complete a structured, defensible evaluation. This process isn't just about checking boxes. It is about confirming that your patient is an appropriate clinical candidate, ensuring they fully understand the treatment journey, and crafting a plan that is precisely tailored to their unique anatomy and aesthetic goals. When we look at clinical audits and complication reviews across the industry, a striking pattern emerges. The majority of preventable adverse outcomes are not actually caused by the physical act of the injection itself. Instead, they are traced back to inadequate pre-treatment assessment, poor planning, or a failure to identify critical contraindications. This section will outline a practical, real-world workflow aligned with U.S.-style clinical standards to ensure your practice remains both safe and effective. Our workflow begins with the comprehensive patient history. In aesthetics, a thorough history is never optional. It directly impacts both the safety of the patient and their eligibility for the procedure. We categorize this screening into 4 key areas. First, medical history. You must screen for neuromuscular disorders, such as myasthenia gravis or Lambert-Eaton syndrome. Because botulinum toxin affects the neuromuscular junction, these conditions are critical red flags. We also look for bleeding disorders and any chronic illnesses that might impair the body's ability to heal. Second is the medication review. This is a common area where preventable errors occur. You must identify if the patient is on anticoagulants, which significantly increases bruising risk. We also look for aminoglycoside antibiotics, which can actually potentiate or strengthen the effect of the toxin unexpectedly. Additionally, note if the patient is using muscle relaxants. Third, we cover allergy history. We are looking for any prior hypersensitivity reactions to botulinum toxin products or their specific components, such as human albumin. Finally, we review previous aesthetic treatments. We need to know, have they had toxin before? What was the dose? What was their response and were there complications? We also check for the presence of dermal fillers or recent surgeries in the target area, as these can alter the tissue plane and your approach. Clinically, this history identifies contraindications and helps us predict how the patient will respond to the treatment. Remember, skipping the medication review is one of the most frequent mistakes in the clinical setting. Once the history is gathered, we must filter that information through the lens of contraindications. These are divided into absolute and relative. Absolute contraindications mean the treatment cannot proceed. These include a known hypersensitivity to the toxin, an active infection at the intended injection site, which could be spread deeper by the needle, and the specific neuromuscular disorders we previously mentioned. Relative contraindications require a higher level of clinical judgment or a decision from the supervising provider. These include pregnancy or breastfeeding, coagulation disorders, or the use of certain interacting medications. Your clinical action here is clear. If an absolute contraindication is present, you must defer treatment. If you encounter a relative contraindication and feel unsure, always escalate the case to your supervising provider before proceeding. Now we move into the physical facial assessment. This step builds directly on your knowledge of anatomy and muscle movement. We aren't just looking at the face at rest, we are looking at it in motion. First, evaluate dynamic versus static lines. Dynamic lines appear with movement, while static lines are present even when the face is still. This helps manage expectations regarding how much smoothing the toxin can actually achieve. Next, assess muscle strength. Is it mild, moderate, or strong? This will dictate your dosing. Look closely for baseline asymmetry. Most people have it, but they may not notice it until after they've been treated. Point it out now to avoid blame later. Finally, check the brow position and eyelid status. Is there any pre-existing ptosis or drooping? Does the patient use compensatory muscle activity, such as lifting their eyebrows constantly to see better? Our clinical goal here is simple. Identify exactly where treatment is needed, and just as importantly, Identify where treatment should be avoided to prevent a poor result. Aesthetic nursing is a unique blend of clinical science and goal-driven artistry. A technically perfect injection can still be a failure if the patient's expectations weren't met. Start by asking open-ended questions. What concerns you most about your appearance today? And what kind of result are you expecting? You must clarify if they want a natural look with some movement, or a frozen look with total immobilization. Explain the degree of wrinkle reduction they can realistically expect, and remind them that these results are temporary. Aligning these expectations during the assessment prevents dissatisfaction later, and is a key part of the informed consent process. Now we translate our assessment into a plan. In safe practice, there is no such thing as a one-size-fits-all injection map. Your plan must specify the target muscles, usually the frontalis, corrugators, or procerus, the specific injection points based on that patient's unique muscle pull, and a total dose range. When it comes to dosing, we adopt a safety-oriented mindset. For first-time patients, the start low and reassess approach is the gold standard. It is much easier to add more toxin at a 2-week follow-up than it is to manage an overcorrection. Remember these variables. Stronger muscles require higher doses. Men typically require more units than women due to muscle mass. And always be conservative with the frontalis, the forehead muscle. Overtreating here is the primary cause of brow ptosis or a heavy, hooded look. Informed consent is a mandatory legal and ethical step that must be completed after the plan is made, but before the treatment begins. You must discuss how the product works, how long it takes to kick in, and how long it lasts. Most importantly, you must disclose potential side effects: bruising, swelling, ptosis, and the possibility of asymmetry. The patient must have a real opportunity to ask questions, and the consent must be documented with a signature. This is your primary shield in maintaining a professional, transparent practice. As we move to the clinical setup, hygiene is paramount. Cleanse the treatment area thoroughly, and ensure all makeup is removed to prevent infection. Position your patient in an upright or semi-reclined position to ensure proper anatomical orientation. Before the first needle stick, we recommend a safety pause. This is a final mental or verbal check to confirm: do I have the right patient, the right product, the right dose, and am I injecting at the right site? This 10-second pause is a hallmark of high-reliability healthcare. Why do we place so much emphasis on this process? Because a strong assessment reduces complication rates and supports consistent, beautiful outcomes. It also provides vital legal protection through clear documentation. When you document, don't just record what you did, record your reasoning. Your notes should reflect that the history was reviewed, contraindications were ruled out, and the patient's goals were considered. As we bring this module to a close, let's perform a final review of what we call the safety gate checklist. This isn't just a list of tasks. It's the final clinical filter you must pass through before you ever pick up a syringe. Mastering this workflow is truly what separates a high-level clinical professional from a basic technician. It ensures that every single treatment you provide is grounded in safety and precisely tailored for a successful outcome. Before you move forward with any injection, take a moment to confirm that you have thoroughly reviewed the patient's medical and medication history. You need to be certain that all contraindications have been either ruled out entirely or escalated to your supervisor if there was any gray area. By this point, you should have a clear physical assessment of their facial anatomy and muscle movement, ensuring those findings are perfectly aligned with the goals the patient shared with you during your consultation. Finally, verify that the informed consent has been fully discussed, signed, and documented in the chart, and do one last double check of your product, your dose, and your dilution levels. Once you can confidently say yes to each of these steps, you are ready to proceed with a safety-first clinical approach.